Hi everyone, I'm Dr. Emerald, Doctor of Chiropractic. This is...
Katherine Garcia, licensed professional counselor.
And this is Painting Wellness. Another episode coming at you. Today we're going to be talking about how do narratives manifest physically. This is a continuation of kind of now a series about narratives. If you haven't heard our previous episodes on just what are narratives, our most recent one before this is how do narratives affect our boundaries, and now the continuation of how do narratives manifest physically. So this is gonna I think be more of a discussion piece, where we're gonna be going back and forth on this. The previous two, Kat has been doing an awesome job describing what narratives are, what boundaries are, how they affect us. So we're going to start off on like how do narratives and boundaries impact care? Because we were actually, after we got done recording the last one, we started talking about this and we were like, do I need to fix my call? Sorry, thank you. Got to keep it covered, folks. Keep it modest. Modest is hottest.
Oh my God. Okay. That escalated quickly, folks. We'll just keep going.
All right.
Narratives and this is like this real life, people. Real life. We're live.
We're doing it.
We're doing it.
So.
All right. Can you collect yourself? We'll go back.
All right. Why don't you start off while I recompose myself? I'm just gonna sip on this quietly.
Yeah. So we are gonna talk a little bit about, or quite a bit actually, of how do narratives manifest physically, because we talked in the previous episode about how narratives impact our boundaries with other people, and how it creates the core belief that really can make us feel icky and not allow us to treat ourselves or allow other people to treat us like we deserve, right? But narratives can impact us physically. It's something that impacts all parts of us. So we have in other episodes spoken about how we are a wonderful machine, all of us, that involve our entire body. It's not just our body and then our mind, and it's all together. And we present physically many things when there's emotional things, right? So how do you think narratives impact us?
I mean, some of the big things that I tend to see with narratives is, as we talked about in other episodes, is like self-worth, and whether or not, like, going into with care, it's like, am I worthy to go and get these things taken care of, or should I just continue like soldiering on, so to speak, because I need to make sure other people are well taken care of. And if there is time, then maybe I can also take care of myself. But it's not the hierarchy.
Yeah. And I think, one of the things, and I know that we were talking about it earlier, and it was mentioned, when we have bad narratives or narratives of we are not enough, it can impact how we present ourselves. So, if I feel like I am not enough, or like I don't deserve that, I might present myself hunched over, which can impact our posture and our neck, which is a big thing. It can impact how we eat. It can impact just overall how we take care of our body, because we might try to kind of reduce ourselves, put ourselves in a little tiny shell, and so that does impact our body, and physically it manifests with pain, right? And so I think that when we're talking about taking care of our body, it's, do we deserve to be taken care of, and what is our narrative doing to us physically that is causing us more distress?
Yeah. I mean, when you were talking about like leaning forward, some of the thing that pops into my mind that I see often is people that are really tall, or just taller than average, we'll say, they have the tendency to hunch or stoop over, because maybe that narrative is, oh, I have to get closer to people, or they think I'm too tall, or they can't hear me, or I can't hear, all of these different things. But it is this going forward, their head is super forward. Not everyone that's tall, but I see that often, where at some point, I'm not a tall person. I'm a short king, that I like to say, but like, I haven't heard those same type of narratives, and if anything, the narrative that I hear is take up more space to maybe compensate for not being the tallest person in the room.
Yeah. I mean, as a a lady, I've always been much taller than most, and I can relate to that. If I were shorter, and how does that, or if you like go through puberty early, and your kind of your bosom grows faster than maybe your peers, and you're just like the hunching over, right? And I know a lot of young ladies that struggle with that because they don't want to be seen as provocative or whatever. So there is lots of narratives that do impact our our body. I mean, I
And
know
at a
that
young age.
at a young age,
Like starting, like, even I like notice that with like kids at like 7, 9, like 13, that I know I can see how their body, like, they are presenting themselves in different ways to either essentially compensate for what they are mentally thinking that they need to hide or show more of, we'll say, comparatively to what their peers or what they see on the media or whatever it might be. But especially like when you're growing and going through puberty and your body's developing, those narratives that are affecting your physical self is then really getting hardwired into your physical body and how you may present for the rest of your life.
absolutely. And one of the there's two big examples that I can give you that match with that. The number one example is eating disorders. The narratives that we tell ourselves about what our body should look like, what we think society thinks we should look like, and how that impacts how we eat is so important for both men and women. And we see kids younger and younger and younger dealing with eating disorders. The other thing, and I am absolutely 100% guilty of this, is the narrative that we have around what we wear and wearing high heels. And I know that you mean ball, like eyeball me every time that I'm wearing my 4-inch heels to work, but in my brain I feel like high heels make me look more professional and more svelte and all those things, which may or may not be true, but that's the narrative that I have, and how it really impacts my back and my neck and all those things. So it's our narratives impact so much of our body that we don't even know. I mean, there's example after example after example.
Yeah, and that's like all these things coming at us from these different things that we make these choices because of the things that we're hearing or the narratives that we're telling ourselves that, as you said, affect like what we wear, which then go follow that trail, can ultimately cause like back pain, neck pain, which then cause digestive issues, all of these things. And going back to like what we're eating, then, man, talk about, especially if you're a developing person, if you're not getting excuse me, the type of foods that you need to grow healthy because you're not eating enough, or maybe you're eating too much and it's just empty calories. Man, if my thoughts are like, how are the organs dealing with that? How's your brain functioning? Because there are definitely things, if your brain and body aren't getting the nutrients they need, they will pull that from other organs. Or like, even there's a piece for, if you're not getting the nutrition you need, your nerves will start to get stripped of their protective coatings to be able to give your brain the energy it needs, which can essentially, I mean, that could put you in a wheelchair.
That's incredible.
Which is like crazy. It's scary, not to say that like that's going to happen to everyone, but it's like those are the potentials, and that can come from these narratives that affect us physically.
It makes me think of our, we're really big on manifestation, and what that's a narrative.
Yeah,
it's a narrative that we believe in. Like, right, if we believe the law of attraction, or we believe that that's a narrative. So our life is really, really centered around narratives. And for the parents out there, these narratives start from when they are babies. Like let's not even start with attachment theory and how people attach and all these things. Those we have these little humans setting themselves up for the narratives, including how to take care of themselves. And so one of the things that I always makes me cringe is when parents are like, well, if you're naughty, I'm gonna take you to the doctor and they're gonna give you a shot. I mean, wow, what a terrible, terrible narrative to instill in kids. Or, even with like people that celebrate with Santa Claus, like if you're bad, I'm going to call Santa Claus. And right. So I have to be, and we're instilling all these narratives. And so, I think that we have to be very careful with what we say when it comes to the narratives to our children, especially about taking care of themselves and what it means to go see a doctor.
Mm-hmm.
And I know that, I know for a fact, I've seen you treat children for a long time, even before you were in the office here. And the kids would come and it was great, and you would see like whole families, and the kids would look forward and they're like, yeah, it hurts
It's
here
a
and it
party,
hurts here.
yeah.
It's like a whole thing. But how wonderful the narratives are behind that my body hurts and it's okay to see Dr. E because he's gonna take care of us, and he's
Mm-hmm.
gonna do that. And so I know that one of the things about us working together is that we share many patients,
Mm-hmm.
because I do trauma work, and trauma, we've talked about this, really impacts our body,
Yeah.
because our body keeps score of all of that trauma. And you've been treating some of my patients as well, and we've seen amazing results.
It's been really exciting, actually. We gush over it like often when we're talking about how like getting these two pieces connected, the emotional mental side and then reconnecting it with the physical, and like people are just like taking off. It feels like that's my interpretation of
Yeah.
like seeing people just glowing essentially, and they're excited, and I think that is a big piece of like we're helping them reconnect some of those things of like, hey, what my body, like our body, what am I trying to say? When we go through trauma, one of the things that can happen is you can get disconnected from your body, and you shut things down. But that is such an important piece of our experience. Like we don't know a lot of things, but one thing we know is when we're done here, we're not taking our body with us. And so like getting attuned to our body is so important. Then it allows us to process further these emotions, and like also like we store emotions in
Absolutely.
different areas of our body, and that's so like that processing of that is so important.
Yeah.
And along with that, like being able to go through, and I think like building confidence in that healthcare style of thing, and that's something I think both of us really do well, is asking people how they're feeling and what they would like to do, and helping them as they're going through care build that confidence, feel empowered with that. And changing those narratives
Absolutely.
of before is like, I don't have that power, or I'm not good enough, to, oh, maybe I do have that ability to make this change, or I do have that power within me to make that one change or that one step that then leads to the next thing.
Yeah, absolutely. And I think, it's very interesting when I'm with patients, and I say, I really would love for you to see Dr. Emerald. And sometimes they give me this puzzled look, and they're not quite understanding what I'm saying. Like, listen, you have so much trauma stored in your body. You're telling me you have all this pain. You can't sleep. You're having GI issues. I really do believe that your body is holding on to this trauma, and I want to give you a tool to be able to move that trauma so we can heal it better. And I mean, you're right. I mean, we gush about it because we see these people that are holding on to this, and they come in and they're like, oh my gosh, like I feel so great. Like I just want to tell everybody about it. Is the feedback I get from my clients. I just love it, and they really like the fact that we do an integrated model, and that they know that it's a safe space. The narrative around care changes, because now it's not just, oh, I'm gonna go there just for my mind and my brain and my mental emotional health, but I'm going to go there, and she's going to help me advocate for myself, and then there's going to be another provider there that's going to help me advocate for my body, and they want to care. It's not like this, it's not this kind of choppy, I feel like, disorganized thing. And it really makes a difference, because, and I know in our first ever podcast we talked about advocating, and having providers advocate for their patients and teaching patients how to advocate for themselves. And I think that when we work together as providers, we are teaching them that as providers, we're advocating for them, and they can also continue to advocate for themselves. Because guess what? If my therapist thinks that the Dr. Emerald can help me, and Dr. Emerald in fact helped me, what other doctor am I not seeing because I think they can't help?
Mm-hmm.
Or, wow, Dr. Emerald, identified that, maybe you should see a GI doctor. And wow, and I never thought about it. And, and things like that. And I think that is so powerful. So we really, as providers, we have a huge impact on how our patients, how our patients' narratives and their boundaries towards themselves to self-care actually change with care.
Yeah. Definitely, and being able to see that is really exciting to see that evolution of that. I think another fun thing that I've been seeing more and more is, and I think we're fortunate in that, like, we're very similar in our approach and our philosophy, we'll say, around this stuff, is that we're consistent with our narratives that we're discussing with our practice members.
Correct.
And so when they're talking to you, you're giving them, it's a different viewpoint or vantage point, but it's still that core belief, those core narratives, and then when they come and talk to me about it, it's the same thing, just from a different vantage. And that continues to reinforce that they do have that power within them, and building that confidence and changing, or maybe adapting that narrative, I should say, going forward. And I think that opens up, as you said, like, the possibility for them to be open to seeking care from other providers as well, because they're having that consistency of positive outlook or positive experiences here, which is so important. Because for myself, I will be the first to say I struggle to go and see providers because I have had some really negative experiences. And when someone is like, oh, well, why don't you go to a doctor or like an MD, I'm like, no, because I had these experiences. And that doesn't mean that all MDs are that way, of course not.
Yeah.
But like, there needs to be that first step.
Well, yeah, but it's
right?
that narrative, right? That's what we're talking about, is this idea of, like, it only takes one experience for us to, in the tisk of our mind,
to
go right back to that, and have even a trauma responses, right? We've talked about that. And so I want to encourage both providers and patients that are listening, that please do not let a negative narrative prevent getting care. If it's so important. And I even say this for therapy. I mean, if you go to a therapist and it's not the right fit, it doesn't mean, first of all, it doesn't mean that the therapist is bad. It just means that they're not the right fit. And please go find another therapist, or find another chiropractor, or find people that are going to have the same values that you have, the same outlooks. Like, if you are, we are very much Eastern medicine people, and we really believe in the combination of Eastern and Western medicine. So if that's what you need, then find providers that actually look into have that same model. And I think that that's really important, and people that work well together. And I think that, having, again, the collaboration, and don't let negative narratives prevent you from getting the care that you need, because that can be so detrimental. And I know that we've talked a lot about that. So, as we kind of, I'm going to gather really quick here. But as we talk about, like, how narratives are, we talked about narratives, what they are, how to boundaries and all those things. We know that narratives can impact many parts of our life. And one of those things is it impacts how we carry ourselves, and how that impacts our body, and how we seek help.
Yeah, that's a big piece, is if we're not feeling like our narrative is not allowing us to do that, then we could be going a long time with ever really resolving those issues that could be life-changing. Like, making that one step could change your trajectory.
Absolutely. Yeah. And, as providers, really, we really encourage providers of all medicine types to please encourage clients to advocate for themselves, to help them have better experiences, to understand that, you know, there are many things that impact narratives, and we have to take into account families of origin, culture, you know, all these very important things. And we don't want to make fun or dismiss people's narratives around care, because the reality is that that could prevent us from treating somebody that really needs our help and that really could benefit from seeing a provider.
Yeah, and if you don't, maybe the provider or the patient side of things, like if it's not a good fit, like talk to the other person about that, have the communication, over communicate on some things, because that's actually, I love that you do something very similar that I do in on the chiropractic side, is I tell people, hey, I'm not a good fit for every person. I know that. But if that's the case, let's discuss that so then we can find someone that is.
Correct.
Because
it doesn't hurt our feelings.
No.
It doesn't
Sometimes. But
but we put our ego aside.
But you got to put the ego aside. Yeah. Like, cuz I'm not going to say it doesn't hurt my feelings, but like I know that like ultimately what I want to make sure is that person has the best possible care. And on the other side, when I hear, especially when I get to hear that, hey, I had a great experience with this person, thank you so much, that like resolves any of, you know, my issues around it. But like that's so important, and that's, I think, what we're really advocating, we'll say here, is that like finding those other providers that can help those type of people. And just because you may or may not hurt my feelings, that should not be a reason that you don't talk to your provider.
Absolutely.
Because like that is our stuff, and those are our jobs to be able to navigate that.
Absolutely. And we're here to help you.
Yeah.
So you're not here to help us.
Yeah.
We want you to get the care that you need, and I think that that's something that a lot of people struggle with. Oh, I don't want to hurt my provider. I'm going to ghost them. And I'm like, please don't ghost us, please. I tell people, if you are mad at me, come and tell me. If it's not a good fit, I'll refer you somewhere else. But don't ghost us, because not because of us, but we want you to get the care that you need. And we as providers have a big network that we can refer to. So we want to advocate for you, even if we are not the providers for you.
Yeah.
So, but that's, I mean, so important. How I mean, it's incredible how all these things connect, and how our body and our mind connect, and you know, we have to take care of all of it.
Yeah, we got to take that look at the whole system and see how, like, it's amazing how integrated that all is. So,
absolutely.
Is there anything else on? I mean, this I'm like almost not wanting to like dig too deep, because we could just keep chatting on this the whole day. Yeah. But it's this really, really important thing is I always go back to, always take that step back and ask, how is this thing that I'm experiencing, this feeling, this emotion, how is that being affected from other things in my life, and how is it going forward affecting those things, and how can maybe we change those?
Yeah. And if you guys have had a great experience or not such good experience with providers, and you want to share with us, and you want to ask questions about how to better advocate for yourself, what questions to ask your provider, please, reach out via social media. If you're watching this on YouTube, they will be listed. We also have Instagram and TikTok, so just reach out, ask questions, make comments, and we will most definitely try to address those.
Yeah. All right. Thank you for joining us on another episode of
Painting Wellness. Yeah.
Hey, Kat. Happy Pride.
Happy Pride.
One, two.
Oh, I'm
sorry. Do you want me to say three?
Yeah.
Okay. How about if I say rock, paper, scissors?
Okay. Yeah, I can do that.
Okay.
I can yes.
All right, let's do it. Rock, paper, scissors.
Oh, I like that.
So
much better.
Rock,